some charts are 10, so you're gonna have them saying at 10 or 20 feet. You're gonna have them read to the line.
And you don't
that
have to do this on your final?
you have to do this on the final.
No.
Oh,
It says
you
it.
have to
Discuss it.
verbalize it.
Right.
Yeah,
to
so that's what
explain.
I'm doing right now. So I'm
You just
verbalizing,
verbalize
I'm
it.
verbalizing the Snellen. So what I would do is I would point to the line that they can start to see, have them cover one eye. Remember what eye you have them cover first, because I've done that. Well, cover your right eye. No, what eye did I just test? Okay. So remember what eye you're asking them to cover. So cover one eye. They have to get, if they get 3 wrong, then you have to go back to the line above and have them read. And then you chart it as left eye, 20/20 minus, if they got 1 wrong, -1 or -2. Does that make sense? Okay, and you chart both eyes. So that's testing cranial nerve. Okay, I'm pimping you. That's 2. Thank you. Okay, so ophthalmoscope, and I always start at 0 on the diopter, because then you can adjust it depending upon what you can, as you're looking in the eye, depending upon what your vision is, their vision. And you'll know what their vision is because you've already tested them with the Snellen chart, right? So you'll know if they wear glasses, contacts. And remember too, when you chart your Snellen, is it with correction? And what kind of correction? Okay? Okay. So I'm going to tell her to focus on a point over my shoulder. Usually I'll tell them to look at the wall, a point on the wall. Because then as they're looking farther away, that's going to dilate their pupil out even more. Get the lights down as far as you can. And I usually look at a point on the wall. And I always start with my eye that I think is easiest. And I can see her optic disc. She's got good eyes to look at. Real well. It's almost incredibly hard to find the macula. But, you know, the optic disc is which way?
Towards the nose.
No, towards the nose, and then your macula is
Towards your ear.
you got it. So then you're gonna switch hands, and then some people put their hand up here so they don't bump into their them, because you know you're gonna be getting pretty close. So if you ate a lot of onions for lunch, you probably want to brush your teeth.
Your proprioceptive skills with your hand on the
Yeah.
forehead tell you where you
Yeah,
are in
where you
space
are.
and
So then you're
time.
kind of balancing away. So I can see her optic disc real well too. And then while I have this, I probably would do her follow my light just with your eyes, not with your head. And kids sometimes they don't get that. So, and I'm doing, what am I doing? Yeah, 6 cardinal vision. And what cranial nerves are those? 3, 4, and 6. Yep. So I'm doing her cranial nerves. And you want to hold it when you get to the top, looking for nystagmus, and she doesn't have any, so we know she doesn't have any lesions in her brain, right? And then I can also just, I can check for direct and consensual right away. So it's tough. I'm just going to bring the light in from the side, and I note that her pupil constricts on the side that I'm shining the light on, which is direct. And then I'm going to look at the other side, and I can't see because it's too dark. I'm going to put the lights back on.
Sure.
Sorry. But I'm looking to see consensual reflex that the other one does, and repeat it on the other side. Okay, so that's direct and consensual. And then the other thing we can do is just focus on my ophthalmoscope, and I'm going to bring it in, and I'm checking for accommodation. Yep, and where pupils constrict, and they accommodate with 1 word. So I think I covered the eyes. Sound good? Did I miss anything?
So for the checkup, do we have to say it just how you did, or do we actually have to say the name of the nerves and which test is for which nerve? Because last week you had said we have to actually say the name of the nerve, not just the number.
Correct.
Okay, so we have to say both.
Yes.
Okay. There's no question.
Okay, good. I'm glad you clarified that because I didn't know the answer either, so thanks. Okay, so I did the eyes. I usually go to the ears next. Get all my equipment. Of course, you guys will be real organized and have all your equipment ready. And one of the things
It'll be
too.
set up at the bedside for you, I believe.
Okay.
I always, if somebody's coming in with ear complaint, I always check the unaffected ear first. Just because then you get an idea of what normal is. So if you're just doing a regular physical exam, it doesn't really matter. So I'm going to look in her ears, I'm going to pull up and out, and I'm going to look in. And it's nice curly gray. I can see the bones of the tympanic membrane real is at 5 o'clock. What? Are you okay? And this one's a little dull. Are you congested? But I can see her leg reflex at 7 on that side. And at the same time, I can look at her ear, look at the pinna, make sure that there's no abnormalities and lesions. Remember, that's the place for skin cancer to form, so I would do that, palpate that also while I'm there. Okay, and then since I'm on the ear, I can check cranial nerve number 8, and I'm gonna just whisper something, and you tell me. I'm gonna have you plug your other ear. Just kind of do this.
Or this one?
No, the other one. And I'm gonna whisper something, and you tell me what you hear.
Hello.
Good. And then I'll repeat that on the other side. Okay? So that's the ears. Usually go down to the, you have to really think about this. You know, usually I don't think about this stuff. Okay, then the mouth. I'm gonna have her open up and say ah. I usually, good. So go ahead and say ah again. Checking the cranial nerve. Which one?
10, 11, and
Yep.
12.
And do you have
And they're
ah,
called Vegas and
Hypoglossal.
your tonsils are really atrophied if you have them. Do you have tonsils?
I did.
Oh, they're really small. Yeah, they're really small. But her uvula rises, her soft palate rises. And then I'm just gonna have you open your mouth. And at this point in time, I'm gonna look around. I'm gonna look at her teeth. I'm gonna look at her mouth. Can you lift your tongue up for me? And I could lift her tongue up if I wanted to. And lift your tongue up, kind of roll it to one side. There you go. And you're gonna look, inspect, make sure that you don't see any lesions or abnormalities. And then I can use a tongue blade at the same time. Go ahead and say ah again. And look for her carotid duct, right? Where's that?
Behind the two.
Yep. And then lift your tongue up again for me. And these ducts are
sublingual.
okay. So that was the mouth. So we did. I'm gonna have you open and close for me. Ooh. She's got TMJ. That was really cool. Do it again. Oh wow! You guys want to feel TMJ is right here. This is great. So that was good.